Hello, my name is Aleena, and I will be the narrator.
I'm Abby, and I will be playing Dr. Adrian.
Hello, I am Fatemeh. I am a Carol as a lab technician.
Hi, my name is Shameema, and I will be playing the role of the patient as Maya.
Listening is something we don't pay much attention to, when in fact, it's a huge part of our everyday lives. There are 5 components of listening. Hearing, attending, understanding, and remembering are 4 of the 5 components that are very important for the listener to do. Today, the component we are going to talk about is responding. Responding is important for it shows if the listener is truly listening, hearing, and understanding. Different ways someone can respond are through questioning, paraphrasing, advising, judging, analyzing, supporting, and prompting. Today we are going to go into further depth of responding in the form of analysis. We are going to take a look at what analysis really is and how it can be applied in the healthcare profession. Analyzing is simply interpreting what someone is saying. By interpreting, it may make something more clear to someone. However, there are also cases where it can have the opposite effect. There are 2 problems with responding through analysis, and they are that you may interpret incorrectly and further confuse the person, or if the person is having serious problems and you try and analyze his or her life, they may take offense and become defensive. It is important to judge the situation you are in and the person you are listening to in order to respond appropriately. Listening in the form of analysis is especially important in the professional world, specifically in healthcare. Some examples of healthcare professionals are doctors, nurses, and lab technicians. Healthcare professionals are constantly analyzing. Doctors and nurses check on patients regularly and record the patient's progress. If something happens to be wrong with the patient, the doctor or the nurse will interpret the symptoms of the patient and treat accordingly. It is important that healthcare professionals are giving correct information and responding to patients in ways that are tactful and kind. In order for us to better understand how important analyzing in the hospital is, let's go visit some friends.
I am Maya, and for the last few days, I haven't been feeling well. I went to a doctor because I have been having chest pains and feeling dizzy. I explained to him everything that I was feeling, but it seemed he did not pay attention to my symptoms. He told me to go home and take rest. He assured me I would feel better shortly. But I did not feel any better, and my condition was getting worse. However, today I went back to work.
Today, at Healthy Hearts Hospital, Maya entered the ER because she collapsed at work. The ER doctor on duty is Dr. Atrium, and the lab technician today is Carol.
Hi, Maya. I'm Dr. Adrian. How are you feeling?
Oh, I am not feeling so great. What's wrong with me? Last thing I remember, I was having chest pains and I was feeling dizzy.
How long have you had these symptoms for?
Chest pains started today, but I have been feeling tired and having troubles breathing for a few days.
It seems you are experiencing symptoms of a heart attack, but we will run tests to make sure.
The doctor sent blood work to the lab for further analysis. The results have returned, and the lab tech is going over the results with the doctor.
It seems Maya had a heart attack based on my findings. Because her levels of creatine kinase and COX-1 and COX-2 are in high concentration in her blood. There is appearance of CK2 in plasma, which is virtually specific for infraction of myocardium. Also, I checked the other proteins like protein troponin in blood, and it was too high. That shows a damage to cardiac muscles.
Thank you, Carol. I will report your findings to Maya.
Hi, Dr. Adrian. What have you found out?
The test results confirm that you had a heart attack. Now that we know you had a heart attack, we'll be doing a few more tests to find out why it happened. We will recommend some medication for your recovery, and in the meantime, rest up and we will be checking in with you.
When Maya experienced chest pains and dizziness, she was the first to analyze that something was wrong. The doctor interpreted Maya's symptoms and analyzed her condition, and the doctor suspected a heart attack. Once Carol had run some tests in the lab, she was able to confirm that Maya had suffered a heart attack. It is important that healthcare professionals are listening and further analyzing their patients, as you can see from Maya's case. Maya saw a doctor before she collapsed, but he wasn't listening to her symptoms. Analysis is a major part of healthcare. Healthcare professionals must be listening, interpreting, and analyzing constantly.
Thank you for visiting us in our hospital.